Yoga as a practice is therapeutic. And there are significant differences between a yoga teacher, a yoga therapist, between a yoga class and a yoga therapy session. Clarity about these differences is helpful for the yoga teacher and therapist, as well as for the student and the client. Atlas looks at this distinction from the perspectives of the yoga student, the yoga therapy client, the yoga teacher, the yoga therapist, the yoga class, and the yoga therapy session. From the perspective of the yoga student, there are many reasons why students go to a yoga class or seek out private yoga instruction. To make a sound decision, we encourage students to look deeply at their intentions for seeking out yoga education, yoga instruction, and/or yoga therapy. Yoga provides the tools for a process of self-investigation and self-development that ultimately guides practitioners towards a deeper understanding of self and others. The general public often sees yoga as a system of exercise. Students most often go to a yoga class to exercise in a venue with like-minded community. Those who come to understand that yoga is more than an exercise may look for instruction to explore the other aspects of yoga, such as pranayama, meditation, or other esoteric practices. And regardless of the intention, most of us benefit by learning and practicing yoga. For the yoga therapy client, when clients seek out a yoga therapist or a therapeutic group, they're usually not coming to learn so much about yoga, but to get help with or relief from a symptom or health condition that's troubling them. In most cases, the instruction focuses on the condition and how the yoga techniques can help them feel better or improve function, rather than on the techniques or the methods of yoga practice. The yoga teacher. There are substantial differences between yoga teaching styles. Some teachers focus primarily on instruction, guiding students through their practices and helping them to practice in their best alignment. The scope of instruction usually includes asana, pranayama, mudra, mantra, and meditation. But fundamentally, instructors using this style will guide the students in their practice. Other teachers seek to educate their students in how to practice rather than or in the midst of guiding the practice itself. This teaching style empowers students to guide their own experience, whether they're practicing alone or in a group setting. In either case, good teachers are able to choose appropriate practices that meet the interest and ability of their students. Whether their style is instructional or educational, student or teacher-centered, yoga teachers focus on teaching the various yoga methods in an intelligent and considerate way. The yoga therapist. Rather than focusing on yoga methods and practices, yoga therapists fundamentally focus on their clients' needs. Their intention is to understand why their clients have come to see them and determine what they can do to support them. To help them in their work, therapists are trained to assess clients through listening, questioning, observing, and occasionally through appropriate touch. Therapists look for ways to help their clients reduce or manage their symptoms, improve their function, and help them with their attitude in relation to their health conditions. After assessing clients, therapists establish appropriate goals with their client, develop a practice of intervention, and then teach clients to practice that intervention. In this sense, therapists choose yoga techniques in relation to how they will specifically benefit individual clients or groups of clients. The yoga class. Yoga teachers may offer a variety of yoga classes, including classes for individuals or groups of people with specific conditions. Common examples include yoga for pregnant women, yoga for heart patients, and yoga for cancer survivors. In these classes, good yoga teachers must learn the contraindications for working with people that have these conditions and respect those contraindications while teaching the students appropriate level yoga. The intention in these types of classes is to teach these students how to practice yoga while respecting their health conditions. The yoga therapy session. The intention changes in yoga therapy sessions for individuals or groups with specific conditions. After an appropriate intake and assessment, therapists often focus on the specific symptoms that trouble their clients and identify methods to help them manage those symptoms. Examples include helping clients with pain management, fatigue, or sleeplessness. In addition, the therapist's role is to empower clients to take a more active role in their self-care. The therapist's job is less about teaching yogic techniques and more about helping clients to overcome their challenges and gain independence. Hence, the job of the yoga therapist represents a different focus, a different type of education, and a different skill set. Commonly, students report great and even therapeutic benefits from their yoga classes, no matter which type of class they're attending. This occurs because of the inherent therapeutic potential of yoga, but it should not obscure the distinction between a yoga class and a yoga therapy session. Although the distinction may seem subtle, it is important for the yoga student and the yoga therapy client to be clear about their intentions when seeking out yoga professionals. It is important for yoga professionals, teachers, and therapists to be clear about the intention and orientation of the work, honest about our level of training and understanding, and realistic about our skill sets. The roles of yoga teacher and yoga therapist are valid and valuable professions. It is important that we, as a yoga community, become clear about the distinction between them. Here at Atlas Yoga Therapy Training, our vision is to train leaders in this emerging, essential field of applying yoga technology to the field of alternative healthcare. We feel that yoga has been used for centuries to improve health and wellness for people around the world, and that research and science is currently being carried out that continues to support the practices that work, help to eliminate practices that are not in the range of safety for all populations, and exploring new ways to approach health on a global level. We aim to educate therapists who see the world as one living, breathing organism. The role of the yoga therapist in that organism is to repair, realign, recharge, and reinvigorate the individual people we encounter in our practice. Healing is a catch-all phrase that implies something needs to be healed. Pain, wakefulness, anger are all signs and signals from our body, our minds, our spirit. That's just information about our current state of being. Yoga technology has the potential to help us to eliminate pain or learn how to manage it, to sleep better, to process experiences, and have healthy expressions of anger and other emotions. The Atlas method uses our layers of beingness, the koshas, as a guide to working with clients on the physical, energetic, mental, spiritual, and emotional levels. All health issues are a complex network of related, interconnected relational elements that can be addressed knowingly and unknowingly through the erudite practice of yoga and the contemplative arts. We hope that you'll join us. Our next intake is January 2022. You'll find more information on our website. And if you have any questions, you can always book a 15-minute info session, and I'm happy to spend time with you. Enjoy the conference, and we look forward to working with you in the future.